Welcome back to Wave Listens Live. Joining me now is Dr. Doug Kane, a.k.a. the Neuropathy Doctor from Cornerstone Wellness Center. And Dr. Kane, as always, it's a pleasure to have you back here on Listens Live.
Great to be here again.
And we've got you for 2 segments today.
Yes.
So I'm excited about that because we got a lot to talk about, including some stuff that we haven't talked about before on the show. So it'll be interesting to learn what you brought with us. But because as the big part of what you do and the most important thing that we've talked about in the past is neuropathy, ways to reverse it, ways to bring somebody back to a way of life that they're familiar with before that neuropathy began causing problems in their life. So for those who are unfamiliar with you, introduce yourself and let everybody know what it is that you do and who you help.
Okay, well, I'm Dr. Doug Kane. I've been in chiropractic practice for 34 years now, believe it or not. That thing is older people say, right? And, you know, so in dealing with neuropathy, my mother was diagnosed with chemotherapy-induced neuropathy, and I was trained in school years ago that there's nothing that can be done for neuropathy. You just have to learn to live with it. And unfortunately, that's still what's taught to most medical providers at this point. The good news is that has changed. The science, the technology, the understanding of what happens to create neuropathy. According to Johns Hopkins, there's about 140 different causes. It is the most common neurological diagnosis in America today. The main cause is diabetes, which we know is just rampantly out of control in our country. Of course, Mom had chemotherapy induced. She's a 2-time breast cancer survivor. Another big cause, orthopedic related issues. So, you know, back injuries, back surgeries, neck surgeries. Sometimes if, you know, you've had a joint replacement like hips, knees, that kind of stuff, it can affect the nerves. Neuropathy can affect any nerve in the body, but it's usually found in the feet first, just because your feet are the farthest away from the heart. And then we have, you know, some chemical neuropathy, things like alcoholic neuropathy. When we think about chemicals, folks are like exterminators, farmers, our Vietnam veterans that are exposed to Agent Orange. So a lot of different things can cause that, but at the end of the day, the root cause is it's affecting the microcirculation to those nerves. They're not getting oxygen and nutrients, therefore they can't function properly, and then that creates a lot of symptoms. And those symptoms can be absolutely excruciating. A lot of pain, electrical shock type symptoms, temperature issues where you feel like your feet are on fire, or you feel like your feet are just absolutely frozen, but you touch them, they're normal temperature. So it's just that abnormal sensation. And then the other one is absence of sensation, which is complete numbness. And then that makes things like driving a car difficult because you can't feel the pedals. Or, and that will also lead to balance issues, which is a big cautionary thing, because, you know, we hear about people that fall and break hips or break arms, or, God forbid, you know, in a bathroom, a lot of hard surfaces hit a head and can have a bad head injury, and sometimes those are fatal. So we take that very seriously, but fortunately we can help reverse that now.
And I'm trying to do the math in my head. 34 years you've been doing chiropractic. You got certified at 8 years old, I think?
Yeah, something like that.
That's incredible.
I was actually one of the youngest chiropractors ever registered in the state of Indiana.
That's interesting.
So chiropractic saved my life as a 15-year-old, and so I knew at an early age this is what I wanted to do. So I got a bit of a head start.
Well, that's good, because it's gotten you to a point where now you're one of the people that are helping people change their lives for the better, especially with neuropathy. We've talked about it before. The better part of the last decade has been dedicated to reversing neuropathy symptoms. We heard the story about your mom and how that got you into how you can help people with neuropathy, and that's where we got into today. So how does that work? How are you able to address the concerns that you've talked about for the first few minutes of this segment, and then actually see results? What does that process look like, and how do people use the resources that you provide to them to see those results at the end of the day?
The first thing, you know, we sit down, we have a conversation, we take a good history, we get to understand, you know, their medical issues, then we do a very thorough, in-depth sensory exam, and so we know exactly what nerves are working, what ones aren't, which ones are causing the problem. Just like any disease process, the earlier you catch it, the better results we're going to get, the easier it's going to be able to treat. It's not going to take as long and get better results and so forth. But there's basically the treatment is there's two courses. There's a home therapy that you do on a daily basis, and then you can do some things in the office that we can accelerate that healing time, so we can cut that down shorter and get you back to your quality of life. And we can get most of that done in the first 90 days. That's when the in-office active part is, and then beyond that, sometimes this can take 12, 18, even 24 months. That's pretty rare, but usually 12 months or so, they're continuing to see results. And in many cases, we can actually get people to the point where they no longer even qualify as having neuropathy. We can reverse that to the point where we can make that go away in some cases.
And we've seen the results. We've heard the results. It's one thing for somebody to say, oh yeah, I feel better, but it's not just feelings and visuals. It's data. It's proving that loss that they have accumulated over the course of however many years is coming back, and you can see that not only visually, but as far as the data shows as well.
Oh, absolutely. Big change in those first 90 days. People will get out, and, we just had the Bernheim folks here, and we were talking about, people can get out and go hiking again, where they used to, they just stay at home and stay in their chair because their feet hurt so bad. And, it's all about the little things, being able to get out and go to family functions, or being able to walk through the grocery store, or, play with your grandkids, or, go to their games and so forth. Just getting that quality of life back so you can do the things that you love and enjoy.
And that's got to be the most rewarding part of what you do, hearing people tell those stories, come back in and tell you just that they got back to doing what they loved, whether that's golf and we've heard from the couple that just wanted to get back on their chopper. They wanted to get back. They want to start riding across country again, and they were able to do that.
Absolutely. We had a gentleman, a mechanic here the other day in the office, and he was able to reach under a workbench. It was kind of dark, and feel around, but he could actually feel the coolness of a wrench. And as he was telling this story, he was breaking down in tears. We had everybody in the office crying, because it was just like, this is really working. And I didn't think, it'd been decades since he'd been able to feel the coolness of something, but the first time he was able to feel something, he could feel temperature differences. And it really is just the little things.
We got to get him on here.
Yeah.
Yeah, have him tell that story on here.
That's the goal. He's only 2 weeks into his treatment, and he's already seeing those kind of changes. So yeah, we're excited about his reevaluation, and that's the first thing I'm going to ask is, hey, will you go on Wave with me, and will you tell your story?
That's great. 2 weeks is one thing. 90 seems to be the number. 90 days to see incredible results, up to 90%. You can go from 90% feeling lost to 90% total feeling, and that's a big difference that people have told us on air that they've experienced in their life. You're back for another segment. We've got plenty more to talk about, so stick around. We've got that with Dr. Kane here. We're talking about pelvic floor strengthening. We'll talk about that when we get back from the break.